Hi, everyone, and welcome to the Freedom for Addiction segment here on the Neil Haley Show. I'm excited to welcome to the program Reverend Wynn Henderson. Wynn, how are you? And it's great that you're on the show again. I'm glad to talk to you.
Yeah, it's been a pretty day outside today, Neil.
Oh, it's a gorgeous day everywhere. That's so true. Just one of those days in February. I guess we're waiting for spring. But our topic today is one of them that's really most dangerous thing going on, really, when it comes to addiction. And a lot of it's led based on self-medication prophecy. They basically get these medications, and that's painkillers and the opioid use disorder. I had an interview with Ryan Leaf, who was a professional football player, ended up in jail, ended up robbing, ended up everything in this disorder based on specifically enough just taking it to get better from the certain aches and pains. But these are so addictive, aren't they?
Absolutely, Neil. And it's easy to fall into the trap of too much medication. One of the most common reasons that people go to doctors is for relief of pain. And there are a number of different drugs that a doctor could use for that complaint of pain, but maybe about 20% of the people will get medication that's called an opioid. And an opioid is a narcotic. These opioids are made from opium, which comes from the poppy plant. Morphine and codeine are the two that are natural products of the opium, but they have man-made versions, which include fentanyl, heroin, hydrocodone, hydromorphine, methadone, oxycodone, and meperidine. Some of the more common ones, but there's a lot of.
Yeah, and when we talked about before on this program, and I've talked about on my show, there are some. What is the basic problem with taking opioids? Because we talked about specifically enough, and you could kind of tell us this straight out. This is such a horrible addiction, and everyone is offered this. It's if you have certain aches and pains, you say you have a back pain, you have neck pain, you have aching knee, or just really you're just suffering in pain. You just go there and they'll prescribe them easily. But what's the basic problem with taking these opioids?
Well, in the past, doctors did give them out a lot easier than they do today. And we have a whole big discussion about drug companies trying to push their product to make money, and the doctors not being totally educated on what could happen when they give a lot of narcotics, but it's tightening up quite a bit. But it's generally safe for you to take these products that's prescribed by your doctor. But in addition to taking them, they can give you relief from the pain, but also they can give you euphoria, feeling of well-being, and the feeling of getting high. Now, this effect could lead you to misuse the drug or take it in a way that the doctor didn't intend. You might take a higher dose than prescribed, take someone else's prescription. You might do that even for a legitimate problem like pain, or you might just take it to get high if you know what an opioid would do.
Wow, it's when you talk about all those things, it's just terrible. It's and how prevalent is the opioid use disorder?
Well, I have figures from 2015. The figures kind of lag behind a little bit, but approximately 2 million Americans had substance abuse disorder related to opioid medications. And today, a few years later, it's significantly higher than that. And for years, we used terms like opioid abuse, drug dependence, drug addiction interchangeably. But the guidelines doctors use to diagnose these issues no longer contain the terms abuse or dependence, generally speaking. The doctor will look for symptoms if he thinks you have an opioid use disorder. And let me give you those symptoms.
Okay.
Here's what your doctor is going to be trying to find out from you. Are you using more of the drugs or using them longer than intended? Do you have an ability to control or cut down your use or not? Are you spending lots of time finding those drugs and then recovering from the effects of them after you use them? You have a strong desire or urge to use. Do you use despite legal or social problems that develop? Are you stopping or cutting down on important activity because you're taking the drugs? Do you use them sometimes while doing something dangerous like driving a car or a boat, flying an airplane? Do you use them despite having physical or mental problems? Are you becoming tolerant? Tolerance means that you need more of the drug or need to take it more often. Are you having withdrawal, which are the physical symptoms when you try to stop taking the drug? Well, we would call it mild if you have 2 or 3 symptoms, moderate with 4 to 5 symptoms, or severe with 6 or more symptoms of withdrawal.
Oh my gosh. What are some of the symptoms of withdrawal?
Okay. If you discontinue the drug, especially quickly and not over a period of time, you probably will have some of these symptoms: anxiety, nervousness, irritability, craving the drug, rapid breathing, yawning, runny nose, salivation, goosebumps, nasal stuffiness, muscle aches, vomiting, abdominal cramps, diarrhea, sweating, confusion, enlarged pupils, tremors, loss of appetite. Those are the symptoms that you're in withdrawal. Now, these symptoms are so unpleasant that it tends to encourage you to continue the drug use. Now, your doctor can give you medications to help prevent these symptoms. Now, the symptoms are called detoxification or detox. The most common ones are morphine, methadone, naltrexone, and lofexidine. So if your doctor gives you this other medication to control the symptoms of withdrawal coming off the opioids, and the detox is complete, you are no longer physically dependent on the drug, but you can still be psychologically hooked, and you would be more likely to relapse when you're under stress or if you are exposed to powerful triggers in your life. Substance abuse is a chronic illness, which means that you may have it for the rest of your life. Most people have a relapse at some point.
It's amazing. After a person has detoxed, what is the recommendation?
Well, I recommend that you start the program that you find in Freedom from Addiction 3 before you go back into relapse. And you can get plenty of information by going to my website, which is www.revwinhendersonmd.com. There are scores and scores of podcast information, which is free, by going to www.freedomfromaddiction.libsyn, spelled that libsyn.com. And thirdly, you can see some videos that you and I have made on youtube.com, and you would search for Win Henderson, MD.
All right. Well, I really thought this is an important subject to discuss. There's just so much information out there discussing this addiction, but not breaking it down in a way that understands what happens. And your recommendation is, if you had a surgery, if you have an injury, do not take these medications, would you?
Well, if you don't have to, if you do have to, take them as prescribed, so many per day, and for a certain length of time, maybe 1, 2, 3 days, something like that, where you have the most intense pain. But you don't want to take them without pain, without significant pain, because you can use other kinds of drugs that are not narcotic, which do a fair job at managing your pain even after surgery.
All right. Well, fabulous. Thanks for coming on again. This is a great segment. My listeners and viewers really get a lot out of it, and I know your fans do as well. So take care.
Bye-bye.